Broad contact compressions can be applied with a whole palm, a loose fist, the heel of the hand, or the forearm. This technique is a non-gliding technique and is typically performed with little or zero lubricant, and the pressure is applied perpendicular to the surface of the patient's body. This particular technique can be used to assess the level of resting muscle tension, look at ribcage mobility, and improve or increase venous and lymphatic return. This technique can be applied over the sheets or directly on the skin. I'm going to show you a couple variations. Usually I will start with some broad contact compressions when I'm beginning a treatment. So I'll use the heel of my hand and I'll apply a pressure that's perpendicular to the patient's body. So it's a downward pressure. I'm applying most of my force through the heel of my hand and a portion of the palm of my hand. And I'm just feeling for areas of tension, areas where there's not as much give in the tissue, to see if there's any areas that I want to focus on when I begin my treatment. So I'm using the heel of my hand as I press down. I'm using my torso to sort of lean forward onto the patient. Okay, I'm not leaning my whole body weight. It's a lighter compression to start with, especially as we're starting to get warmed up. But it's a slow and controlled lean, so I can feel for how that tissue moves, then I can release it. I can move to the head of the table, and so what I will do is place my hands on either side of the patient's torso, and with the palm of my hand and the heel of my hand, I can apply an alternating pressure for the broad contact compression and assess how the ribs move. This gives me an idea of how the rib cage is moving bilaterally. The rib cage should feel springy. So when I push down and release, it should come back up into my hand. If there's not some nice give to it when I push, I note that area, that there's some restriction or resistance there. So here I can feel some resistance. It's not quite as springy. And then I make note of if it's on one side or both sides. And then I know to come back to that area when I'm treating. So a little bit further down, this area's got some nice give to it. I can push and release, and there's a nice give and spring to it. Whereas a little bit higher up, there's not quite as much give. So I want to make a mental note of that area, and I'll come back there when I'm treating my patient. To use broad contact compressions on the posterior leg and gluteals, when I'm in my practice, I typically treat gluteals through the sheets. One of the reasons for this is it is a comfort thing for the majority of my patients, and I feel like I can get some great results without directly contacting the tissue. For your board exams, if it is indicated to treat the gluteals, you will undrape them with your patient's special consent. But when you get into practice, you'll have a bit more latitude and choice when you undrape or keep the gluteals draped. So I'm going to show you some broad contact compressions on the gluteals through the sheets. So typically what I will start doing is I will start with a loose fist. And I'll start up near the sacrum, so the lateral border of the sacrum is right here. I'm going to start just lateral to that sacrum, and I'm going to apply a downward pressure or perpendicular to the tissue, and then release. I like to move sort of around the edge of the gluteals from top to bottom. You can do it with one fist or two. You'll release, pick up your hands, and then move them to the next area. My pressure is going down towards gluteals, and I'm also pressing a little bit towards the sacrum And what that does is it pins the muscle and the tissue against the sacrum and gives a really nice compression on both sides. Once I take my time and work my way and sort of assess what the tissue feels like, I'm noting areas that are tight or tender. And then I can go back in with my forearm and elbow, and I'll spend a little bit more time there, treating the gluteals and waiting to feel a release in the muscle tissue. So I'm taking a nice wide lunge stance. So I'm stepping forward with one leg, and I'm going to apply a pressure with my forearm into the gluteals. To keep this a broad contact compression, I want to apply my force with the majority of my forearm. If I were to raise my forearm and bring my elbow into flexion, now I'm getting more onto the olecranon process, and this becomes more of a specific compression, which we're not talking about yet. So I want to keep a good broad contact with the forearm to cover a wider area. And a broad contact compression is typically a little bit more tolerable for patients, especially if they have tenderness or tightness in a particular area. So broad contact compression is, again, a little bit more tolerable. I'm using my body weight to lean forward, and I'm controlling the amount of pressure that I put on the patient by using my legs and my body to control that pressure. I'm not using a lot of force with my upper body because I don't want to fatigue that. So I'm using my body weight and controlling my body position with a nice long lunge stance as I apply pressure to the gluteals. You okay with that pressure? Good. Good. Okay, so those are two ways we can apply broad contact compressions to the gluteal region. To apply broad contact compressions to the posterior leg, we can use a loose fist. I want to start on the proximal aspect of the leg and then move distally as I do subsequent compressions. So I'm going to apply a pressure, release, and then move down. With this technique, we are engaging muscle tissue. So you can see that as I'm pressing into hamstrings, there's a deformation of the muscle tissue with the amount of pressure that I'm using. You want to keep your pressure at a level that's tolerable for your patient. So if they are tender or indicate that the pressure you're using is a little bit too much, you can always back off your pressure. So make sure you're showing great client or great patient care by doing a check-in with your patient. What I like to do as I'm applying this technique is I'll start proximally and move down sort of one strip of the leg, go back up proximal, and now a bit more medial and down the strip of the leg. And then as I get more medial, if it doesn't make sense, if I feel like I'm reaching to get onto that medial aspect, what I'll do is then just go to one hand, okay, with a long lunge stance, so I'm controlled and balanced. Okay, and then I'll apply that last series of compressions along the medial aspect of the leg with the one hand. Okay, if it makes sense to you and if it feels comfortable, you can certainly use two, but depending on the patient's body and how your body feels as you're applying the technique. When we get onto the calves, I can use a fist to move my way down. I like to use the opposite hand to control that lower leg so it doesn't go anywhere on me. Sometimes if we push, it can roll the leg, so this sort of keeps it in control. The other thing I can do is use my palms and just apply resistance straight down. Okay, remember that this is a non-gliding technique. So you want to pick your hands up after each application and move on to the next area. Okay, so that's broad contact compressions on the posterior leg. Muscle squeezing is a technique that is a non-gliding technique, best applied without lubricant. This can be performed through the sheet if you need to get a better grip, or it can be directly on the skin. Sometimes I will utilize this technique at the end of a treatment if I'm trying to soak up some of the lotion off of my patient's body. So an example would be once I have done my treatment and I redrape my patient, I can do a muscle squeezing of the upper trapezius. So from here, make sure if you can see this, let's try. So we're going to squeeze through upper trapezius and release. Then I can come around to the other side and I can grasp just around upper trapezius. So I'm just grasping with sort of a whole relaxed hand, and I'm grabbing onto upper trapezius. You can do it bilaterally as well. And it's a great way to sort of pick up some of the lotion that is on the patient's skin. To apply a muscle squeezing technique to the posterior leg, we can use a bilateral grip. So I can place my hands side by side over the hamstrings and squeeze the muscle. I want to start proximally, apply the squeeze, and then release, move distally slightly, and then squeeze again. It's important when you're applying this technique that you grip the muscle with a nice broad contact grip so that it feels like a nice squeeze as opposed to being pinchy. If we don't grab enough of the muscle tissue, then it will give more of a pinching sensation. So you want a nice broad grip as we squeeze and move down the leg. When we are working on a larger muscle region and we need to exert more force through our hands, this can be tiring. This technique can be tiring for the hands. So if you need to cover off surface area in a larger region, like the thigh, if you can also squeeze by sort of pressing the hands together. So I'll use the heels of my hands. I want to get in a long lunge position and get nice and low. And then I can press my hands together and release. So that's an alternative way to apply the muscle squeezing. And then that way it might take a little bit of pressure off of your hands if you're working in a larger region. It's a little bit easier when you work on a smaller region like the arms, the upper trapezius, or the calves. So from here again, I can pick up that tissue and squeeze and then release. As I'm picking up the tissue, sometimes I'll just sort of move it back and forth slightly to get a nice grip on the muscle and then release. This is oftentimes performed over areas where there's some nice muscle bulk and muscle that we can grab onto. It can also be applied to areas where there's not a lot of muscle bulk, just in a different manner. So when I get to the feet, I can apply a squeezing technique at the feet or the hands where I'm not grabbing onto muscle bulk, but I'm grasping onto sort of around the foot. And I'm giving a nice squeeze that way. I want to position my body so that I'm squatting low, so I'm not bending over. Okay, and I'm just grabbing the foot and squeezing this way. So I'm going to start close to the heel, squeeze, release, and then I readjust my hand as I move closer towards the toes. Okay, and we can even do a squeeze at the calcaneus. I can interlace my fingers and then just draw my hands together that way. So we can squeeze there at the calcaneus. Okay, so that's muscle squeezing for the posterior leg and foot. Wringing is a technique where we apply lotion or lubricant. It's a gliding technique. And it typically follows superficial effleurage and is applied prior to getting into deeper techniques. I'm going to show you with the back undraped here. I'm going to get some lotion and do a superficial effleurage to spread the lotion. And then we'll get into our wringing technique. So remember, with superficial effleurage, we have our pressure stroke, and then line on a return stroke. My hand's cold, I apologize. Yeah. Okay, so I've got the lotion spread here. I can start this technique anywhere on the back. It can start up by the neck or it can start down by the hips. It doesn't matter because remember the back has multiple areas that it can drain at the inguinal region and the axilla. So I'm going to start at the lower back region. I'm going to start my hands on opposing sides of the body. I'm going to take a nice wide squat stance. I'm going to bend my knees. So as your hands are apart, you're going to squat down. And as you stand, you're going to push your hands together and you're trying to compress the muscles in between your hands. As they pass each other, then you let go so you don't apply as much force, and then you bring them together. You're trying to squeeze that tissue together and release. So as I bring my hands closer together, I stand up. As my hands pass and go apart, I squat back down. So it's important that we're really engaging muscle tissue through this. As you get more comfortable with the technique, you'll feel it easier to sort of pick up the tissue as you compress it between your hands. You want to make sure that you do allow your hands to glide past each other. We're not pinching the skin in between the hands. Okay, and each subsequent pass, I'm moving just a little bit higher until I get to the upper back, and then I'm going to move my way back down. So as my hands come apart, I squat down. As my hands come together, I'm going to stand up. What this allows is for your arms to have to do sort of minimal work, and I'm really making my lower body and my trunk do a lot of the heavy lifting for this technique. Okay, so you can do a pass up towards the neck and then a pass and finish back down at the lower back. So that is a wringing technique of the back. To apply a wringing technique to the posterior leg, first we want to spread the lotion. So I've got some in my hand here. I'm starting at the distal aspect of the limb to spread the lotion because I'm not engaging muscle tissue yet when I do my superficial effleurage. So I want to encourage fluid return to the inguinal region with my superficial effleurage. But I'm not engaging muscle tissue, I'm just engaging skin and superficial fascia as we go through this. So I've got a nice long lunge position. I'm leaning forward, so I'm bending my front knee as I spread the lotion, and as I come back on my return stroke, I'm shifting my weight onto my back foot. So I've got that lotion spread. So now I want to start my wringing technique. I have to start my wringing technique from the proximal aspect of the leg and work my way distal, and then I work back out. When I'm working on the posterior leg, I like to do the wringing technique on a little bit of an angle so I can get access to the most amount of hamstrings. I'm going to square myself to the table, start my hands on opposing sides of the leg, squat down. As I bring my hands together, I'm going to squat up. So I'm going to pull my hands together, let them pass, and then come back together. So I sort of shimmy my feet along. I'm staying low in a squat position as I let my hands pass back and forth across each other. Okay, I can go past that knee joint and then get onto the calves. And I can wring back and forth across the calves, moving proximal to distal on the limb. So I'm working my way in. Okay. And then if I were only doing that technique and nothing deeper, I can work my way back out by coming back up that limb, then from distal back up to proximal. So it's really important that you keep a wide stance, bend your knees, and you're not leaning forward. And this will protect your lower back as you apply the wringing technique to the posterior leg. A C-Kneading technique, or you'll sometimes hear me say C-scooping, is a gliding technique that's performed with lubricant. It typically follows superficial effleurage and then is generally used prior to engaging in deeper techniques. I'm going to show you C-Kneading or C-scooping for the back. I'm going to apply some more lotion to the patient's back first. So I'm going to start with superficial effleurage to spread the lotion. Once I have the lotion spread, I'm going to come to one side of the table and I'm going to do my C-Kneading. This is almost exactly how it sounds. You're making a C shape with both hands. What's important to note with this is that one hand does what we call our power stroke and one hand does the return stroke. So the power stroke is where we're pushing the muscle tissue and fluid in one direction. And then the return stroke just keeps it so that the technique is a little bit more fluid and sedative in nature. So my left hand is doing the power stroke and my right hand is doing the return stroke. So I'm going to show you what that looks like again. So there's a bit more force and pressure being applied through the left hand as I work my way up, and then the right hand is my return stroke. Then I can come around to the opposite side. So again, facing the table, I'm going to move the fluid this way. So my right hand will now be the pressure stroke and my left hand will be the return stroke. This will be more important when we get onto the limbs because we really want to ensure that we're pushing fluid only in one direction to make sure it's got somewhere to drain. To perform C-Kneading on the posterior leg, I'm going to spread lotion first. So I'm starting my superficial effleurage at the distal aspect of the limb. My pressure stroke for superficial effleurage is this direction as I push proximal. I'm engaging the skin and superficial fascia and then a light return stroke. So I'm spreading the lotion, only engaging the skin and superficial fascia. Now I'm ready to start my C-Kneading or C-scooping. So what's important with this is I start at the proximal aspect of the limb and my pressure stroke is pushing fluid in the direction towards the inguinal region. So my right hand, it's facing the foot. So this is my return stroke and my left hand is going to be my pressure stroke. So my right hand is a little bit lighter and my left hand is engaging a little bit more. So I alternate right hand, left hand, but it's also alternating between pressure stroke and return stroke, pressure stroke and return stroke. I'll do one strip of the leg, then I'll come back up proximal and do that medial aspect of the leg. Pressure stroke, light return stroke, pressure stroke, light return stroke. So this is if you're doing it with both hands, so bilaterally, C-scooping. You can also do a unilateral C-scoop or C-Kneading when you're just using one hand, and I'll show you what that looks like on the calf. The one-handed is more appropriate for smaller regions like the arm, the upper trapezius, the calves. So the one-handed version is starting again from the proximal area. So we're starting proximally by the knee and then working down towards the ankle. And I'm pushing the fluid again up towards the inguinal region. So I make that C shape with my hand. I use the webbing of my hand around the calf. I push the fluid up and then I let go slightly. I keep some contact with the patient on my return stroke. And then my pressure stroke pushes the fluid up and my return stroke lightens up on the patient's leg. So each pass that I do, I segmentally move a little bit further distal until I get to where I'm going to finish the technique by the ankle. So if I've worked my way in there, I've opened up all the proximal areas and moved down this way, then when I'm going to finish my treatment or work my way out, then I want to start distal and move my way proximal as I'm coming back out of the treatment. So I can start here and I can push the fluid again up towards the inguinal region. This time I've started distally and now I'm moving proximally because I'm now moving my way out of the tissue and I've released the tension and I've opened up here so that as I push fluid up, it's not going to get blocked. When I get onto the thigh, I can switch back to a bilateral. So now my left hand is going to be my pressure stroke up and my right hand is my return stroke as I work distal to proximal. So regardless of where I'm starting, my pressure is always pushing fluid back up towards the heart and the trunk. Okay, so that's C-kneading or C-scooping for the posterior leg. I'm going to show two techniques in this demo. I'm going to show you broad contact kneading and specific kneading. Broad contact kneading is a larger elliptical movement where again there is a pressure stroke and then a lighter return stroke. And this is as we're engaging with the muscle tissue even deeper than the initial levels that we've worked into. So our pressure starts lighter, we work deeper, and then we work our way back out to lighter. So I'm going to show you some of the progressions that get us to the broad contact kneading, and then I'll show you where we would use specific kneading. So if I start with superficial effleurage, I'm going to spread some lotion. Okay. Remember that on the back, it's a little bit more free game with our pressure and return stroke. So if I'm starting at the head of the table, I can push the fluid towards the inguinal region, and then a lighter return stroke as I bring my hands back up. So now I've spread the lotion adequately on the back. So I can go into either wringing or C-kneading. So I'm going to start with some C-kneading. So this is a technique that is a little bit deeper than superficial effleurage because it starts to engage the muscle tissue and it's kind of like a warm-up. So it's a nice relaxing technique that we start to engage the muscle tissue before we get too deep. So I can do one pass sort of up and down. And now I'm going to get into broad contact kneading. For the back, especially when there's not a lot of muscle bulk, I like to use a full set of fingers and with a reinforced hand. And the reinforced hand means my opposite hand is going to go on top and apply a bit of pressure just so that I'm not fatiguing this hand too much. So I'm going to start near the sacrum or near the lower back, and I'm going to do a pressure stroke. So I'm pushing and then I release as I come back up. So my movement is circular. About half of it is a pressure stroke. So I'm pushing and then I release. This is directing fluid to the inguinal region with where I'm applying my pressure. How's that pressure for you? Okay?
Yeah.
Good. So then I can start to work my way up the back, and I'm going along the erector spinae. You can see that I have a pressure stroke and then a return stroke. And each subsequent stroke that I use, I'm moving segmentally a little bit higher on the back so that I can get closer to the top of the back. You want to take a nice long lunge stance so that you're balanced, and that when you go to apply more force, if the patient can tolerate the pressure that you're using and you feel that you need to press a little bit deeper to engage more muscle tissue, You can lean sort of back and forth. So you can see as I lean, I'm moving my body weight forward. I'm bending that front leg and I'm shifting my body weight back and forth to give me a bit more leverage and to give me more power. If I don't shift my body weight like that, then I'm relying solely on my upper body to generate that force and generate that power, and it's going to fatigue my upper body much quicker than if I use my whole torso and use good biomechanics as I'm applying this technique. So those are broad contact kneading and covering a larger surface area. Once I do that, then I might make mental note of where there's tension in a certain area, and I can go to a more specific knead. Specific kneading can be done with more of just like the fingertips, or in some cases you can use your thumbs. I try to avoid using my thumbs as much as possible because they tend to be a joint that burns out the most with a lot of therapists, but there is certain areas that it's indicated or sort of most easy to apply the technique. So when I'm down around by the sacrum, sometimes I'll do some thumb kneading or specific kneading to get into certain areas down here. The reason for this is it's an area where there's not a lot of muscle bulk, so I can sort of move around some of the bony structures without applying too much force over different parts of the bone. So I can thumb knead around there. I'll also use this up on upper trapezius. If I'm working on upper traps, I can thumb knead as I'm up there. So that is broad contact kneading and specific kneading on the back. To use broad contact kneading and specific kneading on the posterior leg, we can start with some superficial effleurage. So I'm starting at the distal aspect and spreading the lotion proximally. Remember that the reason for this is that superficial effleurage is engaging skin and superficial fascia, not muscle at this point. So I'm mostly focused on the direction that I'm pushing fluid, which is pushing it up towards the inguinal region and the trunk. Once I feel like I've sufficiently spread the lotion, I can go to a deeper technique. I can use my C-scooping or I can use my wringing. If I'm going to wring or C-scoop, I want to square my body up to the table. Take a nice wide squat stance. Notice that I started proximally and I'm moving my way distal. Until I get to the ankle. Okay, from here, I can either use superficial effleurage to just transition back up and go into my broad contact kneading. When I'm kneading on the leg or a large surface area that's meaty and it's got lots of nice, healthy muscle tissue, I like to use a loose fist, and I will either reinforce my wrist with my opposite hand this way, or I will place my hand sort of just behind and let it drag along. So I want to make sure that both hands are engaged in doing something. I don't just want one hand to be resting or not doing anything if I'm working on a large area. I can also, if it's a large enough area, if the patient has enough muscle bulk to work on, I can go side by side with two loose fists. Notice that the movement, the elliptical movement that I'm doing, is actually coming from my shoulder. So I have a very slight bend in my elbows. I'm not hyperextended, and I'm not producing that elliptical movement with my wrist. So sometimes when people are learning this technique, they'll try to get that elliptical movement with their wrist. And this is a lot of pressure and a lot of tension in through the wrist joint. So you want to hold it in a nice, neutral, straight position. And that movement, that elliptical movement, comes from the shoulder girdle. And my pressure comes from leaning my body back and forth to get that force or to generate that the force to apply more pressure during the technique. Okay, if I start to get closer to the medial aspect of the hamstrings, I might switch to one hand, and I'm using my right hand sort of as a guide. I'm following along with it, and it's active, it's doing something as I work on my broad contact kneading on the hamstrings. I can then move down onto the calves. For this, again, I can use a loose fist. Sometimes what I'll do is hold on to the calf on one side with my opposite hand as I work one area of the muscle from proximal to distal, and then I'll come back up and work proximal to distal on this side of the calf. You can also use your forearm if you want to do some kneading that way. So I'll show you with here. So there's a nice muscle bulk right here. I can use a broad contact with my forearm. Okay, and as I'm leaning forward, you'll see that I'm bending that front leg, leaning into the tissue. How's my pressure, patient? You okay?
Yeah.
Good. It's a nice broad contact surface area. And the beautiful thing about getting comfortable with using your forearms and your elbows is it spares your hands. Anything that you can do to feel comfortable with not having to use the tiny joints and muscles in your fingers and your thumb, and you can get more comfortable with using your forearm and your elbow, you will increase the longevity of your practice and your career for years to come. Okay, so those are some options for broad contact kneading on the posterior leg. If you come across areas that are very tight, or there could be maybe some scar tissue or something that you need to break down, then you could switch once you've done all of your broad contact kneading and warmed everything up. Then you could switch to specific kneading. So let's say I feel an area of scar tissue or tension in the calf. I can then switch to some specific kneading where I'm pressing, so my pressure stroke is this way, and then I'm releasing, and then I can use both hands, so my pressure stroke for both hands is going up, pushing fluid that way. And you'll see that as I pick up that hand, it sort of slides back around in a light return stroke to work out certain areas. So I can use my thumbs, or I can go in with a reinforced fingertip, so finger over finger, and I can use my pressure stroke and my return stroke to be more specific. The specific kneading is also something I would do for the feet and the hands. So I would warm up this area maybe with some muscle squeezing, and then I would either sit or squat nice and low, and I can thumb knead along the foot. So I'm going to bend the knee just so you can see what I'm doing in here, but I would keep the patient's knee extended and relaxed so they don't feel like they've got to hold their leg up. But this is what I'm doing on the sole of the foot. So I'm alternating pressure on my thumbs and pushing, manipulating the muscle tissue. Okay, and that's more specific kneading of the foot. If I wanted to do more broad contact kneading, I can use a gentle fist, and I can do something that way. A helpful tip is always checking in with your patient prior to working on their feet to make sure they're not ticklish, just so you don't catch a foot to the face if they're jumpy. Okay, it's just nice to know if they want their foot worked on or not. Okay, so that's broad contact kneading and specific kneading for the posterior leg.